The sky is the limit. If you feel you have the capability, no is not an option. No, believe in yourself. There's so much that you can do.
You're listening to the East Meets West Pakistani Professional Journeys podcast, released bi-weekly every Sunday at 5 p.m. on YouTube, Spotify, Google Podcasts, and Apple iTunes. Welcome to the East Meets West Pakistani Professional Journeys podcast. Today we have Dr. Ayesha, who completed her medical degree from Dow Medical College in Pakistan, her residency in Pediatrics from Milton S. Hershey Medical Center, and her fellowship in Pediatric Infectious Diseases from Tulane University Medical Center. Pleasure to have you on the podcast, Dr. Ayesha.
Thank you. I appreciate the invitation.
Awesome. So I guess we can get right into it. We'll start off with your time in Pakistan. So completing your medical degree from Dow Medical College in Pakistan. Can you talk about your experience in Pakistan and how that has helped shape you as a professional today?
I think our medical school journey presented us with many challenges. Those were the days in Pakistan when we were in med school where there was a lot of political unrest. So our college closed frequently, months on end. Sometimes we didn't know when the college would reopen. And so I think that taught us a lot of lessons in adaptability, resilience, determination. We just became used to the challenges. It wasn't if we were going to be able to get through, it was how we were going to be able to get through. Just stopping and giving up was just never a consideration.
Yeah. I could imagine it would have been quite hard to stick to medicine, going through, the process you were mentioning, the closing in and out. And how did you know that you were fully interested in medicine? And I'm assuming that the closing of the universities and whatnot, that must have been challenging on its own, but then sticking till the end, getting it done, and then, continuing in the US as well. So where did that develop?
Back then, really, there were literally only two things what people considered worthy for anyone to do, especially for women, right? You got married and you had a family and that was it. Or you went to med school and a few went to engineering school, but engineering was really not such an option for women as much as for men. And then over the years, slowly, the third thing that became available was doing accounting or going to business school. But that was still not that common back then. It was really do medicine. And so that's what a lot of people did. For myself, though, I would say I always just, ever since I can remember, just wanted to do medicine. I can't give you a very good reason. That's what I wanted to do. I don't know, maybe it sounds like a cliche or something, but really it was for me, it was a calling. And it was just something I wanted to do. I just could not imagine seeing myself do anything else.
Yeah, it's really interesting because in medicine, it's such a long process sometimes. If you have any recommendations for other people to maintain that level of focus to reach the final stage of either fellowship or so on, is there any thoughts you have? Because some people obviously they leave midway through the journey. So do you have any tips of just sticking till the end and not stopping and trying to finish off everything in one go?
I think the first thing is you have to know that this is what you want to do. Medicine is, like you said, it's so long. It is tough. There are so many challenges along the way. It really is one of those professions where it's something you should want to do. It is not something you should do because it sounds cool or it sounds fancy or your parents want you to do it. And I have one daughter and people always ask me, oh, so your daughter's going to do medicine? I'm like, no, she's going to do what she wants to do. And if she doesn't want to do medicine, that's the last thing I want her to do. So it's something you have to want to do. And so that's the first step. I think people sometimes who give up is because it wasn't something that really called to them. And so then you give up. You need to be determined. You're going to have to work really hard.
Yep.
Hours are long, but the rewards are tremendous. It's really honestly not on just monetary. In fact, if you want to make a lot of money, forget about medicine. Right. There are other things these days where you can make more money. Medicine is more about, I guess, the gratification from whatever it is you do, whether you're in education or your clinical practice, taking care of people. Those are the things that really give you to me, profound satisfaction. And that is something you have to want. And that's what keeps you going. And also knowing that you're going to have to make some sacrifices along the way, even with your kids. Like I wish I could have attended more school lunches with my daughter and done things like that, but I couldn't. But at the end of the day, it all works out. I think our kids are also develop resilience. They understand what we are doing and we are all the better for it. But again, you have to want to do it and then be prepared to work hard, be prepared to make some sacrifices. But the rewards are also tremendous at the end.
Got you. And did you have any role models that assisted you along the way? Or what are your thoughts on any role models that you had that helped you or propelled you forward?
Originally, see, I come from a family of people in the media, politicians, lawyers, really not too many physicians. My parents were not doctors either, but I think my parents worked hard and supported our dreams. And but once we were in med school, obviously we had many good teachers along the way. People I still remember with so much respect up to this day. And then subsequently, as we went through our schooling and then further training, of course, here in the US, I was very lucky to find good mentors to really help guide us and move us along the right way. So having good mentorship is very important.
Okay. And do you mind just walking through your journey from Pakistan to the US? How was that process like for you?
So again, because I didn't really have any immediate role models as such, basically after completing med school, I actually did a internship and I actually did 6 months in pediatrics and 6 months in internal medicine. And that's really what made me decide on pediatrics. It was time to choose what we wanted to do. I really wasn't sure even then. I knew what I didn't want. I did not want to do OBGYN, which was again for women that was the one thing everybody did. And I said, for me, I was like, no, I'm not doing it because it's a year's internship and you do 6 months in one and 6 months in another specialty. Most females chose pediatrics with OBGYN or OBGYN with internal medicine. And for me, it's like, I'm not doing OBGYN. I don't really care. So I did 6 months of peds and 6 months of internal medicine, but peds was so much fun. And to this day, too, it's fun. And I enjoy and love every moment of what I do, which I think is why I was still going on at this point in time. After my internship, then that was the time a lot of people in my class were taking, it used to be called ECFMG, now it's USMLE. People were taking that, and some people had already started coming to the US. And so that's when I always knew I wanted to study more. There was so much more to learn. So I decided that's what I did then. I started preparing. I was a little bit late because, again, people in my class, I think some had already started in the final year. But regardless, I took the exams, came here, applied for residency. And then subsequently after residency, I went on to do my fellowship in pediatric infectious diseases. I then spent a couple of years. I did actually go back to Pakistan for 2 years. I worked at the Khan University. I
Nice.
started as a clinical instructor and then I became an assistant professor. And I also became involved because by then, this concept of residency training had also seeped into Pakistan, and AKU had a pediatric residency. So I became an assistant or associate program directors. There it was more like a coordinator. So that's when I was like coordinating educational sessions and lectures and whatnot. And I'm still in touch with that very first class that I taught. And they still reach out to me. It's so funny. And especially now with social media, they can find, yeah. So I'm still very much in touch with some of them. And then after about 2.5 years at AKU, I came back to the US.
And do you mind just telling the listeners, like, what does pediatrics involve? What is like, for people who don't know what it is? Do you mind just giving more details on that?
So pediatrics involves taking care of children, just taking care of adults from the age of basically from birth. And then for some practices and in some institutions, they take care of kids all the way from birth up till 18 years. For some, it may be 21 years, a few practices, especially if, they're dealing with children with chronic medical conditions, may actually take care of them for longer, like up till age 25 or so. We're pediatricians, we are like parents, we don't want to let go. So some of us keep our kids, especially those who have chronic medical conditions, longer. If you're a primary care pediatrician, you're really responsible for making sure that they grow up healthy, monitoring their growth and developmental milestones, anticipatory guidance, those kinds of things. Those are what you do, immunizations, etc.
Okay.
And then for me, I chose to do a subspecialty. My subspecialty, as you mentioned earlier, is pediatric infectious diseases. So I did a lot of primary care throughout my career, and I still actually do some inpatient general peds, hospital medicine type of work. But my main clinical work is really pediatric infectious diseases. So that basically taking care of children with all kinds of infections and infectious diseases, simple, uncomplicated infections to very complicated. One of the things I also do is take care of children with which thankfully now, because of the advances and all the research that has been done, we don't see too much now, but HIV infection, which especially for babies is something that they would acquire from their mother. So that's one of my areas of specialty also within PID. But then I take care of kids with pretty much TB and all kinds of hospital acquired infections that immunocompromised hosts get if they have weakened immune systems due to cancer and maybe some medications that they are on, and then the simple bread and butter infections that we all get.
Got you. In terms of people who already have a medical background and they move from Pakistan or immigrants in general, and they go to the West, Canada, US, UK. Obviously, there's a lot of people that get into the survival mode, like in terms of trying to just live through and get sick. And then eventually what happens is that they don't follow through with their medical degree despite wanting to do it. So do you have any advice for people who are interested in coming to the West and want to pursue their medical profession, are a little hesitant because they might not be able to because of the survival portion or staying afloat kind of situation?
Yeah, see, there are many challenges, and especially
Yeah.
for the US. Unfortunately, you may have been practicing for years and years, but when you come here, you really have to go through the steps all over again. So you have to do residency with some people, and there are like some people who are doing programs that have some sort of accreditation. You might be able to get away with a waiver of 1 year of training, but the American Board of Pediatrics does not, especially in pediatrics, I'm obviously most familiar with that, doesn't allow for more waiver of more than 1 year. And I'm sure most of the other specialty boards are the same way.
Yeah.
There is some time that you must do here before, and that's basic residency. Doing residency is essential because that's your gateway into the American healthcare system. Without that, you can't practice medicine here. Although now with the pandemic and the extreme healthcare shortage, there are actually one or two states, I know Tennessee, for example, where they are looking at some other pathways where experienced physicians may be able to practice medicine as long as they are supervised. But there are many sort of caveats to that also. Definitely, it is difficult. So I think for people, though, I would say again, if this is something you really want to do, don't give up. You have to have the, again, determination. I think we are all hardworking, so hard work is not an issue. Just not getting disheartened by all the obstacles along the way and just continuing to find a way. And one of the other things that happens is if you come here and you don't get into a residency right away, which of course is also very difficult and challenging, there are many international graduates that go unmatched every year, then
Yeah.
try to find something else, something that is related to medicine. For example, maybe you can look at pursuing another degree. Maybe you can look at doing something in public health or maybe pharmacy or counseling. I mean, there's so many different venues that you can continue on that may ultimately then open a door for you to get into medicine. And you may decide along the way that, okay, I'm not going to practice, but I'm going to work as a pharmacist, or I'm going to work as a counselor or something like that, which are all related to medicine. You're still providing care to people. And there's honestly, these days, there is just so much room, and there's such a shortage of not just physicians, but all other allied health providers, that I would say that's what I would suggest to someone who wants to continue doing what they're doing, but maybe can't get in directly. There are indirect ways, or you can just get into education. I mean, there is a
Yep.
shortage of educators also. And part of what I do right now is medical education. And that's also very gratifying. Taking care of patients is one thing, but also educating the next generation of physicians is also, I think, a huge contribution that we can make. And physicians who have come with a lot of experience in their home countries, but then are struggling here, that is another way for them to continue to find like fulfillment.
You mentioned a really important point about how if a person doesn't get into residency, then they could try these different outlets. But have you seen individuals that even if they didn't get it in their first year, like if they kept trying, or is that even possible to keep trying to match with Spill for residency?
You can keep trying, and people have done that, but that's why it's important to keep doing something, because if
Okay. Yeah.
too much time passes, then
Yeah.
it becomes very difficult, because it's important to have a good story to tell. And the
Yeah.
other thing these days that a lot of physicians are doing is they're going about things in a reverse way, meaning they are going into subspecialty like fellowship training, because a lot of subspecialties in the US are going unfilled. The spots are going unfilled. There are some that are extremely popular that everybody wants to do, and there are some specialties that are hurting really badly. So
Yep.
what physicians can also do is, but then again, choose it for the right reason, not just because you're doing it to try to get your foot in the door, because at the end of the day, then that's what you're going to be doing for the remainder of the time that you're working. So, but you can get
Yep.
into subspecialty, and that then does open a door, especially for older graduates who would not otherwise get into a residency program.
Oh, sorry. I thought this was like after resident. I thought the fellowship is usually after
It
residency. So
is.
you can actually do it before.
Usually, the knowledge pathway is you get into residency training and then you go into fellowship. But because fellowship programs are going unmatched, so there lots of places now are taking individuals into their fellowship program. The problem is that then after fellowship, though, you still need to do residency. You can't be board certified until you have board certification in your basic specialty. So for in pediatrics, you have to be board certified in general pediatrics, then you can take your subspecialty boards. But again, doing it the reverse way actually does, because there you are getting into the US system in a way, and you're gaining experience. You're gaining experience with the EMR. You're gaining experience with getting acculturated to the US medical system, learning how to deal with not just the system, but the patients, and the way things are done here. That does actually open the door for many foreign graduates that way. So again, there are lots of different ways, and people shouldn't give up hope if this is something they really want to do. And
Yeah.
I think right now is also a unique opportunity, because there is such a shortage of healthcare providers, and it is in some areas it is really reaching like critical levels.
And I guess we've mentioned it throughout this entire interview in terms of the process of becoming a doctor. But I guess starting from the beginning and obviously till residency slash fellowship, what is the process? If you were to explain it to like a high school student or someone who's interested in medicine in the US, what would that process look like?
So essentially, if you were in high school, then you go to college, and depending on the country, on some years sort of an intermediate, 2 years, in some years like in the US, you have to do your 4 year initial bachelor's degree. You would have a certain concentration in terms of certain courses and things you would have to take. Then again, depending on where you are coming from, there are entrance examinations. So for the US, it's MCAT that you have to take, not like similar to LSAT that you have to take before you enter law school. And then once you pass that and you get like a certain score, then you get admission into medical school. And then after medical school is at the completion of 4 years, then the next step is then you have to apply for residency. And along the way, so the exams don't end though. You take your
Yeah.
MCAT, you go through residency, then you have to take the USMLE 1 and 2. And now USMLE 1 is just pass fail. USMLE 2 is you still have a score. So it is important to do certainly pass at the very least. Then this process of applying for residency and getting into residency, whatever it is you're interested in doing. Once you're in residency, you still have to take USMLE Part 3. And then once you're finished with residency, then the next step, if you wanted to do further subspecialty training, then you would go into fellowship. Or for some individuals, that can be the end of the road, at least where training is concerned. And you can go into primary care practice, whether it's pediatrics, internal medicine, family medicine, psychiatry, etc. And then different residencies also have different durations of trainings. Or within, like for example, pediatrics is 3 years, but there are some programs that are 4 years in training. But you can practice essentially after you finish residency, unless of course you want to go on to subspecialty training. So it is definitely, it's a long road for sure.
Yeah. And I guess even after finishing all that, like I think so every year you have to do like a refresh exam or
Yes.
is that,
Obviously, after taking your board exams, now what they have is something called maintenance of certification,
yeah.
where before it used to be, it was time limited and in I even forget now, 5 to 7 years, you had to take an exam. Now they've made it a little bit, I guess, depends which way you look at it. Simple or maybe difficult because then you have to accumulate certain numbers of points. You have to have ongoing CME, which is continuing medical education by attending lectures or courses, or like someone like myself who's in a med school, although I also need ongoing CME, you have to have continue to do quality improvement activities. And also there is test questions that you have to do. They have taken the exam away, at least for us in pediatrics, as long as you continue to do the quizzes that they send us every quarter, and you have to have passing score. So it's kind of different in every specialty, but there's like a process. You have to continue with ongoing medical education courses to make sure that your knowledge is up to date. And that's important to keep your board certification and obviously then your licensure so you can continue to practice.
Got you. And in your experience from the beginning stages of getting like medical school and then all the way up to fellowship, where do you find that a lot of people really struggle or they fall off in terms of their medical profession? Is there like a specific time period that you see a lot of people like go down and just leave the medical profession altogether? And how do you see them overcoming that?
I guess the first step is med school. There are many students who may struggle through medical school. You do
Yeah.
see people, failing, have remediating, those kinds of things. I think the environment has changed in the sense that a lot of schools now are recognizing that it can be tough. So there's a lot of resources for people. There's a lot of mentorship, a lot of educational resources that are available that help people through. If you can survive the initial challenges and really understand what it takes and how much studying you'll have to do, and that you are going to have to give up some of the activities that you enjoy because you just may not necessarily have time during certain periods, like when it's time to take tests and things like that. If you can get through it with support from your school, with good mentorship, then people do survive medical school, but it requires a support system through the school as well as your own peer network. I think that's very, very important. Have a good supportive peer network, especially for the young folks of today. I find that's where they really struggle. They are not like us. Like you couldn't beat us down. You'd beat us, we'd stand up. You
Yeah.
push us down, we'd stand up. But it is different today. And then the next step people falter at is from medical school to residency. It's a huge
Yeah.
jump. It's a
Mhm.
huge jump. And whereas all the medical students I talk to, they all say residency is hard because that's what they've heard. But what it really means, they have no idea that your medical school is now over. You're entering the workforce, but you're still a trainee. You are a doctor, but you can't practice medicine independently, right? You have
Yeah.
to work hard, but you're not getting the paycheck that you really want to receive. So that's another thing. And so these 3, 4, 5 years, whatever it is of training that you're doing, at the beginning. I think once people get through the first year or so and they realize, okay, residency is a job. Training, but it's a job. I
Yeah.
have to come in at a certain time, I have to leave at a certain time, I have certain responsibilities. It's something like med school where, maybe you have a certain number of classes in a day, you go attend the classes, then you have time. You go, you do volunteering, or you do all these other extracurricular activities. Residency is not going to be like that. You have a lot of requirements. You have to do certain scholarly projects and quality improvement and whatnot. But that is in addition to your day job. So I think that's where people struggle a lot also. First year intern can be pretty challenging. Then again, from residency, if they are going on then to fellowship, I think by then most people are more prepared, they're more mature, they have really realized what it's all about. And especially when you choose fellowship at that point in time, most people, you know what you want to do. This is what you've been passionate about. This is what you've been waiting for. So I think that transition is a little bit easier. It can be challenging for some also, depending on the program, and maybe the program didn't turn out to be what they were expecting or the workload wasn't. But I think people fare better at that. The main issues are, again, earlier in medical school, really understand what the requirements are. And then you make that jump from medical school to residency. And the initial period there also, just getting used to now not being a student. You're still learning, but you're not really a student anymore.
And you went through so many really good like points in terms of the transition from like overall from starting from the beginning all the way till fellowships and like the struggles that some people have. So I guess in terms of your career, it's you've done so many things, publications, managing a residency program. Is there any specific areas or activities that you did that you're extremely proud of or accomplished from the experience?
So I think what I'm most proud of is, obviously I'm grateful that I've had the opportunity to touch so many people's lives and hopefully make a difference in so many children's lives. But really, what has been the most gratifying to me is the ability to, my role as an educator, and really to continue to contribute and make sure that at least the people that I am responsible for, make sure that they are going to be the best pediatricians that they can be, and that they'll go on to make a real difference. So really paying forward all that I have been given. I've been fortunate enough to have experienced, and it's extremely gratifying to me that even after they finish residency training, so many of my physicians that I have trained continue to reach out to me for one thing or the other, whether it's,
Yeah.
hey, do you have a few minutes? I have a new job that I'm looking at. I just wanted to pick your brain about, or I'm having this particular issue or this struggle. And, you always helped in residency. So, yeah, you okay if I call you for just a few minutes, or something happened, or I met some other alumnus from the program and we were just talking about you. And so I'll get this random picture from them and whatnot. So to me, that's really gratifying. It's really nice to know that you were able to touch someone in such a way they still remember you long after they have graduated from the program. So I think my role as an educator is something that I've found to be very fulfilling.
And in terms of the future of medicine, not getting too like in private or any specific details, but where do you see the future heading, or do you have a general idea of what the future might look like, and specifically pediatrics?
So I think medicine, like everything else, I think technology is really changing how we do things. And of course, the advent of the electronic medical record was a huge thing. that has come
Yeah.
with its own challenges. And now, we're looking at ways to have physicians back at the bedside rather than spend so much time charting in the
Admin.
EMR. And so to combat burnout, because that's what with the younger trainees, that we didn't go to med school to sit in front of a computer, fill out all these forms and do all these histories and physicals. We just don't have enough time at the bedside. But it's here
No.
to stay, and it has so many advantages of its own. And then, of course, as you're seeing more and more seep into everything, artificial intelligence and
Yeah.
using virtual reality for training, I think that's going to take a bigger and bigger role in how we train and how we educate. And you can sit at your computer honestly and learn so many different things now as if you're in the real space. So I
Yeah.
think there are all those exciting things to look forward to as we go forward.
Gotcha. And in terms of inspiring or aspiring doctors that are going into the profession, do you have any piece of advice? Like, I know you already mentioned just the willingness to keep pushing through the entire process. I guess that resounds for sure. But do you have any other, or is that one of the main ones you would say?
I guess that's the main thing. And also,
Yeah.
like you mentioned earlier, be sure about what you want to do, be passionate
Yeah.
about what you want to do. And that's really going to be the biggest motivator for you going forward, no matter, how many challenges come your way.
Okay. And in terms of the skills and habits you've developed through this entire process, what do you feel was a few of the main ones that really pushed you forward? Like, I know obviously you're trying to push through the process, but there must have been some habits or something that you did that made you keep on pushing. I'm curious what that was.
Just being very disciplined and knowing what I had to do. And I'm a list keeper, keeping track of all my tasks. I think being disciplined is really, really important to keep yourself on task with everything, and not just your work. Also, it is important to have a balance and know when I need to close my books, or now I need to spend time either with family or doing other things, so that you don't lose perspective of things. And I think that's important to, keep going in the long run.
Okay. And do you use like a actual physical diary, or is it more just like electronic where you just keep track through your calendar,
Both.
mostly all the oh,
Both. Yeah.
got you.
Yeah.
Okay. And yeah, in terms of success, both professionally or personally, like you can take it any way you want. How do you define success in your own terms?
So I think coming here as an international graduate, as a woman, a minority, and I'm a professor of pediatrics. I went through the academic ladder in a timely manner. I am leading in a leadership role in my institution. So I would say professionally, I think I have succeeded as far as I can tell. I think I've done well. And also I think that I'm also a good educator as well as good clinician. So to me, professionally, that defines success. And besides that, I've managed to raise a very level headed and sensible daughter. So that's also, I think, an important measure of success.
And the final question is like, in terms of women who are interested in breaking into and they're concerned of there's a glass door or they can't push further, what advice do you have for those individuals that have that hesitation going into medicine?
So for me, I would say to them, the sky is the limit. And never allow anyone to say, if you feel you have the capability, no is not an option. No, believe in yourself. No, you can. There's so much that you can do. And then the rest is just going to follow.
Awesome. Thank you, Dr. Ayesha. That was like, went through so many different topics and it was really helpful, like in terms of just the knowledge that you were able to provide. And thank you so much for taking the time. I know it's like extremely busy, like you were mentioning as well. Thanks for taking the time to get on
You're
this call.
most welcome. Thank you for giving me the opportunity. And I hope that some young folks will find some things helpful.